Hey, I'm Flavia. I have a voice recording that will be playing while I am drawing and expressing my professional creative identity, how I view the art and the science of nursing. I'll go further into that and kind of talk after the audio is done um, on what I drew and why I drew it. So I really hope you enjoy.
Hi, my name is Flavia de Sosa. I am a student at UNCW for the RN to BSN online program. This is a video going over my professional identity project, discussing how I see myself as a professional baccalaureate nurse, how I present myself as a professional baccalaureate nurse to the public, and kind of delving into the art and the science of nursing. For my project, I wanted to challenge myself and try and draw kind of my depiction, how I view kind of my own perspective of the art and the science of nursing in and of itself. As a professional BSN nurse, I really do see myself as kind of that long life learner and really an advocate for my patient. And my self-reflected identity currently relies more on the art of nursing, since I am new to this profession. I am a new graduate nurse. The art of nursing is really something of passion and something of, emotional character qualities. It's just really about passion and emotion behind the care. The science of nursing to me is more of the clinical practice and the pushing of meds, the performing of procedures, and kind of utilizing best practice and backing that up with research. I do not remember what someone truly does if I'm in the hospital with a loved one and I'm not the one taking care of them. I really do not remember what they do clinically, but I do remember how they made me feel and how they made my loved one feel. So this overall is very representative of my professional philosophy of the baccalaureate nurse at this time. I really think the BSN nurse built upon the bedside clinical practice of the ADN nurse with a lot more leadership, a lot more research, and really extending to community health rather than just in the hospital setting. As a professional BSN nurse, I wish to present myself to the public as a community leader, as a resource. I really want to expand and extend my leadership role by getting more involved in the overall health and wellness of patients in that outpatient setting, whether it be a clinic, whether it be some type of rehab unit. I think that would be very fulfilling. This past week I did attend a 3-day cardiovascular symposium, and I really was inspired by one doctor that was talking about a new program, a stroke program called Compass, that focused more on transitional care of a post-acute stroke patient from hospital to an outpatient clinic. They went into depth talking about how there is this role of a post-acute stroke nurse coordinator that manages the care plans and kind of facilitates the referrals and collaborates on the modification of the patient's treatment and even monitoring whether they're taking their meds, how rehab is working for them. That's something I really can see myself doing as a BSN nurse. Being that outpatient resource for someone in the community and not only having an impact for the patient outside of the hospital setting, but also really impacting the family, hopefully in a positive way. And I feel like we really have to remind ourselves that patient care doesn't stop once the patient leaves the hospital. So what I took away from the cardiovascular symposium is that for a chronic disease process like stroke, it's imperative for us to do a better job with following up on our patients outside of the hospital setting. And they kept mentioning during the cardiovascular symposium about how the lifestyle choices of the patient and the social aspect of them outside what they do in their daily lives really is what affects the overall health and the care of the patient, and has a greater impact than those couple days or couple weeks that they spend with us in the hospital. I was looking up a definition to kind of guide me on the art of nursing and the science of nursing, and I found one. It was a concept analysis using Rogers' evolutionary perspective. And it says it's conducted to examine the meaning of the art of nursing. And it said the art of nursing is the intentional, creative use of oneself based upon skill and expertise to transmit emotion and meaning to another. I really do think it really is about compassionate care. It's very paramount, and that the human touch far supersedes the knowledge and the skill set that we utilize to handle machines and handle medication dosing. It's kind of that next step, that building block, because first you really do have to know the basics. You do have to take care of your patient appropriately, but then expand upon that and improve your bedside nursing. And that, for me, it means that they will be more than just a patient that I see in ICU bed number 47. It'll be Mr. or Mrs. So-and-so that I took care of and got to know their family very well and integrated myself in their life, and hopefully been that big support system that they need to get through this difficult experience. So the science behind nursing, it really does make you a good clinician, but the art behind nursing makes you a good human being. And one of the examples that I think of with that is the execution of a stroke team during an emergent large vessel occlusion of the middle cerebral artery, which is kind of where I got my inspiration for my drawing. The science behind nursing and the application of placing IVs, knowing your NIH stroke assessment tool front to back, the administration of alteplase during a CTA, and the clot retrieval that we use now via a stent. That's all of the science of it. And when you're looking at those CT scans and seeing the amount of damage that's occurring and the penumbra of that ischemia that could end up being necrotic brain tissue. But then when I look at the art of nursing, I really look at what is that affecting for the patient's life? Will they ever be able to go to that daddy-daughter dance that they were wanting to go to? Would they be willing to speak to their loved ones after an acute stroke? Will they be able to go to their loved one's wedding and stand up and be able to walk? That's really more of the emotional side of looking at a stroke, for example. We just sit there and we kind of do the calculations in our head of what artery is it affecting, how much is the damage, what is the outcome. We look at percentages and numbers, but the art of nursing is really getting down to the nitty-gritty and evaluating the quality of someone's life.
Awesome. That seemed to be perfect timing. I'm not the best at drawing, but I'll kind of go over my pieces. Almost relatively finished. So I just kind of wanted to go into my depiction of the art and science of nursing in this visual. Kind of how I visualize it. I've been focusing a lot on stroke lately just because that's what I've been shadowing. I've been shadowing one of the neurologists, and since we had such a big discussion about neurovascular care throughout the cardiovascular symposium that we just attended this week for our critical care orientation requirement, for me visually, I kind of see the brain when it is sustaining a very massive infarct. I think of it in two ways. I think of the clinician side um, as kind of an ADN nurse. Since I'm still an ADN nurse right now, I really think of, oh goodness, what am I looking out for? How am I going to take care of the patient? I need to put an IV in. I need to consult the doctor for this. I need to do referrals because I know they're going to have rehab afterwards. They're probably going to not be able to move one side of their body. They're maybe going to have deficits depending on where in their brain that they have the infarct, especially if it's on the right side. They're going to have a lot more impulsivity. It's going to hurt any type of like decision making if it's on the frontal lobe. If it's on the left side, it really is more of language, speech, being able to communicate to your loved ones, and also a lot of the cognitive processes of math and science. So I'm not sure if it's inverted correctly on the screen. I did it on opposite sides, but so when I am taking care of a stroke patient, I'm thinking of all these things. I'm looking at where the infarct is, whether it's the middle cerebral artery, whether it's the external or internal carotid, and kind of where that deficit lies, because that's really the physician's job. But as a baccalaureate nurse, I'm thinking of what new research have I learned about that I can implement as a nurse and kind of collaborate with the doctor on that further. One of the good example right now that they were discussing is the new ELVO program that we have. New Hanover Regional Medical Center is trying to become a comprehensive stroke hospital. Right now, currently, we have Dr. Doss and Dr. McKinney is of neurology, but Dr. Doss is the interventional neurovascular part of that. And as a nurse, as a BSN, I would love to, um, if I'm interested in stroke, which I seem to be, I'm trying to get my feet wet. Neuro is a very hard subject for me, but I like it because it's so challenging and it has a lot of reward. Um, but I'm trying to think of what I would do if we became a comprehensive hospital. What kind of leadership roles would I like to start pursuing? And definitely, I would think something outpatient clinic that I could do on the side of just bedside nursing, so I could still gain my clinical skill, remain strong as an ADN nurse, but start building into that section where I can maybe collaborate care and look at a coordinator position once I attain my baccalaureate nurse, my BSN. So I'm working on the clinical aspects, still getting my skills, trying to be strong. But for me, what I have to emotionally rely on is this portion right here. So when I'm looking at a patient, I really don't understand a lot of the stuff that's going on currently because I don't have much expertise in that area. But what I kind of focus on now is all of this here, which I'm just small doodles, but it was to represent all of the deficits that happens in a person's life, not a patient's life. A lot of the times we just think of the numbers and the outcomes of will they be able to walk? Will they be able to talk? Are they going to get out of this or be in a vegetative state? But currently, I think of more of, oh goodness, will this dad be able to go to his daughter's wedding? Will he be able to take care of himself so his family does not have that burden of performing his ADLs for him? What cognitive deficits will he have at home? Will he be able to take his medication properly if he has um, his mathematical portion of his brain is not necessarily computing each med that he has to take at what time? So I kind of represented that by putting the heart, just thinking more of the um, care and compassion that we deliver to a person, of thinking about how it affects them outside of the clinical setting, outside of all of the math and numbers and statistics. Really, will it affect their life? Will they be able to celebrate victories and kind of improve their mobility? Will they be able to go to their loved one's next birthday? Will they be able to see someone that's getting married in their family? All of those things really attain to the quality of life. Um, and that's kind of where nursing is headed more so, more towards. I'm sorry, I can't talk. But that's something that really impacted me when I went to the symposium. They had all the data to back up their new inventions, new technologies, new devices, new medicines. But what I really took away from it was how everything is shifting towards thinking of the quality of life of the patient outside of the hospital setting, which is something that is available as a role for a baccalaureate nurse to pursue, to kind of specialize in one area, conquer that, um, know everything there is to know about stroke, and then really be that resource and that support system and that rock for both the family and the patient. So it kind of diminishes all the negative adverse effects that you see outside of the hospital with readmission rates and maybe not taking their medications and sustaining another TIA again because they're not thinking it's important. They don't have the perceived benefits. Um, I hope this was a good representation. This is kind of how, in my mind, it works for me. I think of one side, the math. I think of it as a clinician, and then I kind of have the emotional side, thinking of it as a human being, how I would perceive my family if they were in that situation, and what I would want the medical staff to do for my loved one or for myself if I was placed in that position. So I always try and stabilize the patient first, think of them as from a clinician's point of view, and then kind of go from there as to how to bring someone back to the absolute greatest capacity and level of functioning that they have, trying to get them back to their baseline. Um, and then just supporting them emotionally through that journey as well. But I hope this was a good representation. I really appreciate being able to do this project. It means a lot to me, and it really is challenging. I haven't drawn in a long time, but it definitely motivates me as a professional to look at different options for me within the community and kind of branch out from my security blanket of the hospital setting. So I want to hopefully impact people in a positive way and impact their family members to have an overall good quality of life, not just for one day, not for one week, not for a month, but for the majority of their life, to have as much quality and love and excitement and interaction as possible with others and not being always in the hospital. So thank you so much. I appreciate it. Bye.